Dear audience, I would like to present my PhD research. The title of my thesis is Oral Health of Patients with Eating Disorders. My name is Adrienn Széll, and I work as a dentist at the Department of Prosthodontics. My supervisor is Zoltán Géci, and my scientific methodology supervisor is Adrienn. My vision is to improve recovery rates for patients with eating disorders, and my mission is to assess oral cavity differences between patients with and without eating disorders. I have two ongoing projects, and my primary goal is to conduct a comprehensive literature review to identify oral manifestations associated to eating disorders, and based on the findings, I would like to conduct clinical research to further investigate these observations. So the title of my first project is Investigating the Prevalence of Oral Conditions in Patients with and Without Eating Disorders. So, eating disorders are becoming more common today. The current prevalence of all eating disorders range up to 33% in women and up to 13% in men. 10% of people with anorexia nervosa die within 10 years of getting the disease, and 20% will die after 20 years. It means that anorexia nervosa has the highest mortality rate of any psychiatric disorders. 80% of patients with bulimia nervosa do not receive treatment because these people usually hide their condition. Even though after 6 months, first signs of tooth loss may occur, it means that the dentist could be the first healthcare professional to encounter a patient with an eating disorder. So here I outlined some oral manifestations. For example, vomiting can lead to dental erosion, or hemorrhagic lesions, or hypertrophic parotid glands. The use of inappropriate use of diuretics or laxative can refer to hyposalivation or xerostomia. Or, for example, extreme diets and nutrition deficiencies can lead to cheilitis or glossitis. So my aim is that dentists can recognize oral signs of eating disorders for timely intervention. So the clinical question that guided my research is, how do eating disorders affect the oral parameters? P refers to patients undergoing dental visit. E denotes patients with eating disorders categorized into 4 subgroups, like anorexia nervosa, bulimia nervosa, binge eating disorders, and eating disorders otherwise not specified. C refers to patients without eating disorders, and measurable outcomes would be DMFT, erosion rate, soft tissue lesion, periodontal condition, oral hygiene parameters, and the salivary gland enlargement. My hypothesis is that these patients have worse results for oral parameters. So the clinical implication is clear. Early diagnosis of eating disorders through oral examination is crucial for timely intervention. So here you can see the flow chart of my selection. We started with 9,500 papers, and at the end of the selection, 88 papers remained. And after the citation chasing, I could add 4 articles altogether. I had 92 eligible papers. Here about my first project progress. We started with after the duplication removal, we started with 6,000 articles. We remained to 92, and actually we completed the data extraction of these 92 papers. The title of my second project is Comparing the Oral Health Status of Patients with and Without Eating Disorders in Hungary. It will be a cross-sectional prospective observational study. So today, eating disorders are becoming more common, especially in developed countries such as Australia, Northern and Western Europe, and North America. And there are regions which are where there are low prevalence, for example, Africa and Eastern Asia. For example, in the US, in every 52 minutes dies someone because of an eating disorder. As I mentioned, 80% of patients with bulimia nervosa do not receive treatment, even though after 6 months the signs in the mouse could be seen. So my aim is that the dentist can recognize oral signs for eating disorders for timely intervention. So the clinical question that drives my research: do patients with eating disorder have worse oral parameters than people without eating disorders? The population would be patients undergoing dental visit. The exposure would be patients with eating disorder. The comparison would be patients without eating disorders, and my primary outcome would be dental erosion because it's the key indicator for the oral damage. And my secondary outcomes would be DMFT, periodontal soft tissue lesion, and oral hygiene. My hypothesis is that patients with eating disorder have worse oral parameters than patients without eating disorder, and my clinical implication is early recognition of eating disorder. So here I outlined the inclusion and exclusion criteria of the protocol drafting phase. So my inclusion criteria would be for the population, the eating disorders patient that a specialist diagnosed them, and the control subjects are confirmed of not having a risk of eating disorders by Eating Disorder Inventory 2. It's a questionnaire. And the exclusion criteria would be pregnant, lactating, and patients who have systematic disease that can affect the oral status, dental professionals and dental students preventing bias due to their knowledge of the oral health, patients undergoing dental treatment involving rehabilitation of dental structures is because of the main outcome, the dental erosion, removable partial dentures and total denture users because it can also affect the oral parameters, and retained mastication zone. And to summarize my project, this study bridges the gap between the dental health and systemic conditions, highlighting the dentist's role in multidisciplinary healthcare teams managing eating disorders. So I would like to end my presentation with my sister's motivating words: in the coming years you will be the next academic weapon. Thank you for your kind attention.
Thank you for your presentation. I have a question regarding the second project. Do you plan on making any subgroups in this as well?
Thank you for your question. It depends on how many patients will come to and take part in the research. If I have enough patients for every subgroup, I would like to make subgroups.
Thank you.
Then I have also a question according to your second topic. I'm curious about how would you like to involve the patients with eating disorders into the study?
Yes, there is a psychiatrist who helps me with the patients and another one from the pediatric clinics. So I can invite patients from the younger population and the older too.